Imagine a world where affordable healthcare is available to everyone, where your health doesn't depend on your wealth.
I earn barely 100 rupees a day. How could I afford it?
And where being healthier makes you wealthier.
Health really is at the center of development.
It's a transformative idea, and it's called universal healthcare.
The strength of a nation lies in the health of its citizens.
For decades, most of the rich world has taken it for granted. But for poorer countries, affordable healthcare can still sound like pie in the sky. And yet, it's more realistic than you think.
It can be done at all income levels.
So, how can developing countries, whatever their means, pay for and deliver universal healthcare?
เป็นไงลูกวันนี้มีการบ้านไหมครับมีนิดหน่อยทำเองได้ไหมลูกต้องให้พ่อสอนไหม
Narong is father to 10-year-old Puri, but in another world, he might never have enjoyed fatherhood. Back in the late 1990s, Narong was diagnosed with chronic kidney failure, aged just 20.
พอรู้ว่าคุณหมอบอกว่าเป็นโรคไตวายเรื้อรังก็รู้สึกตกใจครับแล้วก็เศร้าใจด้วยแล้วว่ามันคือโรคอะไรทำไมมันมาเกิดกับเราเมื่อตอนอายุเรายังน้อยอยู่เลย
Narong, a shopkeeper, did not qualify for healthcare coverage, like most Thai people. In desperate need of a kidney transplant, costing nearly $8,000, his family were forced to rely on loans.
ครอบครัวก็พยายามดิ้นรนนะครับซึ่งก็ต้องทุกคนก็รู้สึกเครียดคุณพ่อ
ตอนนั้นอะไรก็เบิกไม่ได้พ่อเขาก็มีเงินเดือนอยู่ก็ไม่พออะไรก็หมดไม่มีอะไรเหลือ
Years later, Narong and his family learnt he needed a second kidney transplant, which would have meant financial ruin. But this time, everything was different. The state picked up the bill.
ทำให้ครอบครัวไม่ต้องกังวลตรงนี้ครับเรื่องค่าใช้จ่ายเพียงแต่แค่กังวลเรื่องว่าไตจะทำงานดีไหมแค่นั้นเองครับผม
Today, more than 99% of Thailand's population has access to affordable healthcare. So, what brought about such drastic change?
It became their key campaign promise for the upcoming general election.
In the early 2000s, a new Thai government became one of the first developing countries to treat their population to universal healthcare. The policy plugged the previous gaps in coverage, making affordable healthcare available to all Thai citizens, rich or poor.
No country reaches this nirvana of perfect universal health coverage, but Thailand took a huge leap during that period.
Robert Yates advises developing countries on the rollout of universal healthcare, a policy that need not be the preserve of rich countries.
Universal health coverage is everyone getting all the health services they need without suffering financial hardship. Obviously, it depends on a country's level of wealth as to what package of services you can provide to everyone. Even low-income countries have at times been able to introduce a universal health system.
So, are other developing countries following in Thailand's footsteps? The good news is that global healthcare coverage, people accessing essential services, has improved. The bad news is this is only half the battle. Far too many people are still having to pay unaffordable and crippling costs. The proportion of households spending over 10% of their income on health has risen by 40% since 2000. This isn't true universal care, which urgently needs administering in higher doses across the world.
What you want to move away from is out-of-pocket spending, sort of people buying and selling some services, which is a wretched way to fund a health system. Without that financial protection, then a lot of poor people will never access the health services.
So, what needs to change for more countries to be able to cough up for affordable healthcare, like Thailand? The answer hinges on public financing, or how countries extract the money to pay for it. Usually, three sources provide the necessary cash injections. There's mandatory taxes collected in the workplace, known as social insurance contributions, general taxation, with a slice of all tax receipts earmarked for healthcare, and other state income, like selling natural resources. Countries tend to prescribe all three, but the precise dose depends on their circumstances, like the makeup of their economy and their working population. It sounds all well and good, but what about the poorest countries with limited income and few workers in the formal economy who can pay taxes? One nation has led the way here, with a transformation that would have been unthinkable some 25 years ago.
More than 500 Tutsis were hacked to death here among the pews, a gruesome testimony to what amounts to the world's latest display of ethnic cleansing.
Rwanda is infamous for the genocide, which tore the country apart in the mid-1990s. But it was this darkest hour which sparked the introduction of universal healthcare. Since universal healthcare was rolled out in 2004, infant mortality has dropped by 59%, maternal mortality by 67%. And today, the national scheme covers around 90% of Rwandans and pays for at least 90% of their medical costs. It's an extraordinary turnaround, and the financial remedy lies in innovative grassroots funding, what's known as a community insurance scheme.
The payment for insurance is not the same for everybody. A poor person will contribute what they can afford to contribute, which ensures that they are not impoverished, whilst the ones who can afford more will contribute more.
This community insurance model doesn't raise enough by itself. The pot is topped up with other central funds, including development aid from foreign donors. It's not a perfect model by any means, but it could be copied by more countries. The trick is successfully pooling different sources of funding, allowing more healthcare to be provided at lower cost than if people are left to purchase care themselves. It's this principle of pooling that ensures everyone is covered.
It's vital that you have a pooled financing system, otherwise it will only be rich people who will get services. If you want it that health services are being allocated and consumed according to need, then it has to be a publicly financed health system whereby wealthy, healthy members of society subsidise the services for the sick and the poor.
Reforming how health services are paid for can only get a country so far. Making sound decisions about how this public money is spent is just as important to delivering universal healthcare. For this, countries need to triage their health spending and invest in the care which saves and improves the greatest number of lives. This varies from country to country, but all services should be assessed for their impact, value for money, and feasibility. In Thailand, it's Dr. Jaded Tamatatari's job to help decide what services make the cut.
มีความคุ้มค่าเมื่อเราจะลงทุนคือเราจะใช้จ่ายเงินเพื่อให้ได้บริการดังกล่าวหลักสำคัญคือจะใช้เงินที่มีจำกัดอย่างไรให้เกิดประโยชน์สูงสุดมาก
It's Thailand's commitment to this strategic approach that ensures it gets better bang for its buck than the world's wealthiest nation, America. On the provision of essential health services, the two countries score evenly. But Thailand spends around $700 per person to achieve this, while the US, one of the only developed countries where healthcare is mostly left to the free market, spends almost $11,000 per person. Like other developing countries which have successfully implemented universal healthcare, Thailand has adapted its priorities. Initially, it focused on basic treatments for infectious diseases and child and maternal health. Since then, the needle has moved, with the country becoming richer and life expectancy higher. Now, Thailand prioritizes managing chronic diseases like cancer, heart disease, and kidney failure. Today, Narong has a monthly checkup appointment at his local hospital.
วันนี้คุณณรงค์เป็นยังไงมาบ้าง
ครับก็สบายดีอยู่ครับ
It's been 4 years since he received his second kidney transplant, fully paid for under Thailand's universal coverage scheme.
ไม่เหนื่อยนะทำงานได้
ครับ
Like many, Narong benefits from Thailand's focus on primary healthcare, which manages illnesses within communities.
โดยทั่วไปก็1,000ก็ดีนะคุณณรงค์นะผลเลือดก็ใกล้เคียงของครั้งที่แล้วไม่มีอะไรเดี๋ยวหมอจะส่งคุณณรงค์ไปพบนักกำหนดอาหารนะเพราะว่าให้เขาแนะนำเรื่องอาหาร
This focus on primary care is a core part of universal healthcare and key to delivering it around the world.
The provision of care in the community is really important. It makes it easier for community members to access. It is cheaper. It is provided by somebody that they know. It means that they can get it as early as possible. Primary health care is really the driver of universal health coverage.
Universal healthcare can make a country not only healthier, but wealthier too. When people like Narong live longer, healthier lives, countries reap the rewards of having more productive populations.
ผมยังโชคดีที่ได้รับการปลูกถ่ายไตโดยไม่ได้เสียค่าใช้จ่ายทำให้ได้มีเงินเหลือเอามาลงทุนเอามาสร้างร้านทำให้ครอบครัวมีกิจการค้าขายครับ
Rather than saving for a healthcare emergency, would-be patients can spend their earnings, boosting the economy. And there are other benefits too.
There's very strong evidence that providing people with universal health services makes more people inclined to pay their taxes. And it just raises this expectation, that spending money, that taxes are a good thing.
And one of the biggest advantages of all comes from minimising the devastating impact of health crises.
ดังนั้นบทเรียนที่ประเทศไทยพบคือว่าการมีหลักประกันสุขภาพเหมือนเป็นพื้นฐานของไม่ว่าจะเป็นแพนเดมิกหรือในอนาคตจะมีวิกฤตทางด้านสาธารณสุขใดๆเข้ามาก็เชื่อว่าจะสามารถจัดการได้
The world has seen, looking back through history, that it's actually been at times of crisis that a number of these great universal health reforms have occurred.
Britain introduced universal healthcare following a war, Thailand during an economic crisis, and Rwanda after a genocide. The recent global pandemic should be the wake-up call to roll out universal healthcare in more countries.
I'm Tom Standage, Deputy Editor of The Economist and Editor of The World Ahead. To read more of our future-gazing coverage, click on the link. Thanks for watching and don't forget to subscribe.